You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Hello, and welcome back to part 2 of our Accessia 2025 recap series, where we're sharing conversations with attendees and exhibitors from this year's Access to Pharmacy conference in Las Vegas. We've got more great insights lined up today, from what's making waves in pharmacy access to the real-world conversations shaping the future of care. This episode is brought to you by Lumicera.
78% of physicians reported in a national survey that authorizations often led to patients not receiving their treatment. Lumicera specialists and pharmacists work in a coordinated effort as part of the patient care team to reduce that authorization burden and get patients on therapy quickly to obtain those desired outcomes from their treatment.
Eric Huckins is the Vice President of Business Development of Lumicera Health Services, sponsoring the Pharmacy Podcast Network at Access to Pharmacy 2025 here at Accessia. Eric, welcome back to the show. How are you?
Doing well. Thanks, Todd.
Hey, it's been good working with Lumicera Health over the years. It's great to have you back. The representation that you bring to pharmacists and their profession in general is pretty important as someone who's influential. You made the Pharmacy 50 most influential leaders in pharmacy and representing the specialty pharmacy space. I think that's important. So let's right out of the gate, let's talk about influence for the future. Maybe pharmacy students that are listening in, but also pharmacists that want to move out of maybe a retail space and they want to get into specialty and they really like a specific disease state. Talk to me about that kind of influence and why that's important.
Yeah, absolutely. So, first and foremost, want to give kudos to you for recognizing pharmacists. Really what it means to be influential is giving back to the profession. That's what I love most. I had no clue what specialty pharmacy was as a student at UW-Madison, and kind of honestly fell into it a little bit, and through the years have been lucky enough to learn and grow and see it evolve, and kind of my commitment and goal has been to give back to students. I'm a residency program director that we have a PGY2 leadership program. I feel like that is a really important aspect to train our next future pharmacist leaders in specialty pharmacy. One, because it didn't really exist in our school and our program at that time, and now we have the opportunity to give back. So I love doing that.
Well, that's important, and I like that Lumicera Health pays enough attention to that. You were able to come into Pittsburgh and share kind of some of the story with us. We had so many students reach out to us about specialty in general with questions and follow-up. Something that this leads to, so we talked about advocacy and being representing specialty, right? Well, guess what? That meant something to the point of moving the needle for Costco to now partner with Lumicera Health. This is huge, Eric, and I'm so proud of you guys. So talk to us a little bit about how that came up and the success that brings.
Yeah, really interesting partnership. Costco's been a partner for a while now with Navitus, our parent organization, and it's a real interesting marriage when you look at SSM Health, the health system, and then Costco coming together to find ways to bring value to pharmacy, specialty pharmacy specifically. So what was really exciting as far as an update this year is our Lumicera's integration and partnership with Costco to provide. What Lumicera does is cost plus specialty pharmacy. We've done that since the day we opened our doors 11 years ago. And really what we were able to do now with Costco is bring a name everyone knows and loves and be able to extend that to more more employers, more patients doing cost plus through that partnership. So it's been a real win-win, and we're excited to see this year. We've got close to 20,000 patients we expect to have on board in specialty by the end of the year through this Costco initiative. So we expect that to just continue to grow, and the market and the industry is really looking for an appetite of transparency, and we're there to be that solution, honestly.
You're an innovator, and Lumicera pays attention to what's happening, and that means how they're going to pivot and build programs that help patients where they are and what disease states that they're dealing with, and the technology that you're employing and leveraging. So talk about innovation. How is specialty pharmacy evolving, and how's Lumicera keeping up with all that?
Yeah, well, I mean, it's evolving several ways. I mean, in some regards, I think just our transparent model and how we do cost plus is innovative. So we, as I was just mentioning, we are seeing and hearing a lot of patients and employers and health plans that are calling for a new way to do specialty pharmacy, a new partnership, and so our model has been able to do that. And what's so cool about specialty pharmacy is that we tend to be early adopters of new innovative, whether it's technology, health tech, or clinical programs. So being able to extend those to more patients is also really exciting for us. Yep. So we're doing some cool things with some med tech, adherence device, clinical programs around that, particularly in the oncology space with these extremely high cost medications that are life saving. So I go back to, I'm just really fortunate and lucky to have kind of fallen in this field, and my job is really to just kind of continue to propel those innovative technologies and solutions to more patients.
A technology that we're hearing a lot about on the Accessia 2025 post show is gene and cell therapy, and how that is going to impact the ecosystem, especially disease state management. So Lumicera is playing right into that, and I wasn't surprised when I saw this. So from your team, I was kind of excited. So talk to us about that facet of the business.
Well, you look at the drug pipeline over the next 5-10 years, and you're going to see a lot of gene and cell therapies. And talk about innovation. These are, in many cases, curative treatments now for patients with debilitating diseases. And being a part of specialty is supporting those patients, supporting those treatments, being experts in those ultra rare disease states, and so that's really what we want to be at the front line of that. We've got amazing patient support to help navigate these patients through getting access to these treatments. So yeah, we're excited. That's where we're investing a lot of time and energy, because we know that those treatments are going to be game changers.
Absolutely. We were talking about how do we get pharmacists to be the hub of healthcare, where they have the information, they have the education, they have the safety protocols, they're communicating with the physician, they're giving the data back to the manufacturer through like a REMS report of some kind, they're coordinating care, they're helping with finding payment options. Like, there's so much going on, and that's why Accessia is so important. So talk to us about being here at Accessia, being a partner of this organization, and being one of the specialty pharmacies that are out front. You guys are really making waves.
Yeah, well, I haven't missed one in the 10 years that I've been lucky enough to come, and it's because you come here and you see all these innovative technologies, solutions, vendors, and it's really a area where manufacturers, pharmacies, plans, PBMs are coming and really figuring out how do we solve the future of specialty pharmacy for our patients. And it's so collaborative. That's what I love about Accessia, is you're talking with everyone, and everyone's looking for ways to collaborate. And so that's why I love coming, and I always walk away learning something new.
Something that would be interesting for me to ask you in the position that you've been in, because you've seen it evolve in your career within specialty. How do you think artificial intelligence is what's the biggest impact that it's going to have on specialty pharmacy specifically, in your opinion?
Well, there's that is a question. There's so much that AI can do and support, and then obviously needing to ensure from a HIPAA and protecting patients that we do that due diligence as we're rolling out AI. But AI, it will allow us to bring treatment and access quicker than ever before. There is so many complexities when it comes to specialty pharmacy with costs, with the disease states that we manage, navigating through different specialists and sites of care. And AI is able to take a lot of the administrative burden that occurs and often causes delays for patients, and it removes that and accelerates the time to treatment. So I think that's where AI, what I'm really excited about, where we're looking at incorporating and integrating it, is how does it help us get these treatments in patients' hands quicker?
Absolutely. Eric, it's been so great spending time with you here at the show, working with the Lumicera Health team. Shout out to Barb and her being the rock of our, management of my craziness and running around to every conference. And just shout out to the rest of your team. Shout out to Ben. Ben couldn't be here with us at Accessia. He's having FOMO right now listening to this podcast, but we wanted to shout out to him. But excited about you coming back. I want to dive into some new innovations in products and disease states that Lumicera Health's working on. I would like to get some physicians involved in our conversations and do a collaborative review, maybe about a specific disease state and the challenges that patients are facing in something that you guys are seeing success in. But thank you so much for being part of Access to Pharmacy 2025.
Well, thank you, Todd. It's always a pleasure.
Lumicera Health Services is lighting the way to a healthier you. As one of the only cost-plus specialty pharmacies, Lumicera is dedicated to providing auditable, lowest net cost prescription pricing, all while ensuring patients receive the very best possible care. With a patient net promoter score of 5.5, it's easy to see Lumicera isn't afraid to take the time necessary with each patient to listen to their needs, educate them about their therapies, and foster a caring relationship. Their patient digital engagement platform has also contributed to the successful outcomes of their patients, providing simple, easy ways for patients to request refills and find additional information regarding their condition. And Lumicera is utilizing their expertise to help build successful solutions for health system specialty pharmacies. By applying the very same pricing and patient care models, Lumicera is able to duplicate their processes to help grow health system specialty pharmacies. To find out more about Lumicera and see what else they have going on, go to lumicera.com.
Hey, this is Dave Griffiths with Accessia Health, and you're listening to the Pharmacy Podcast.
Dave, it's great to have you here on Access 25, Access to Pharmacy, Accessia here in Vegas. Thanks so much for spending time with me.
Oh, great to be here. Thanks for asking.
All right, Accessia Health, special organization, one of our sponsors last year. We're really appreciative that we've worked with you. We want to get an update from you. I want to, when I think of what Accessia Health does in assuring that payment is provided for different treatments and diseases and what people are going through, we can talk about it from a business perspective. You, in the realm that you are, Tierra, running the organization. But what I want to do is I want to hear it from the patient's perspective. I want to hear what patients hear out there about what they're experiencing and how Accessia is helping them.
Yeah, it's a great question. And I think, we were talking earlier offline about some of the challenges that as an organization, obviously being a non-profit, we are limited in the amount of scope that we can help provide patients. And we're always trying to stretch that dollar, like every non-profit in America is trying to stretch the dollar even further. But I think some of the things that we've been hearing, some feedback from patients is always great. I mean, it's wonderful when we go to, when you're at Accessia, it tends to be more specialty pharmacy, pharma focused. We go to a lot of advocacy conferences and we hear directly from patients. And, one of the things that I'm hearing a lot from patients, obviously, is that, without the assistance of an organization like Accessia or the other patient assistance organizations that are out there, these patients don't know how they'd be able to function. And they would not obviously be able to get their medications or get the support they need. And I think that's something that we try and communicate not only to our potential pharma donors, but also other organizations involved in the health space, those companies that are making medical devices, companies that are making support facilities for patients. Those are the ones that we're trying to get that message out there, that there is much more. And one of the things that I tend to talk about a lot when I'm doing presentations is that patients are more than just a prescription. Mm-hmm. There's a whole holistic side to what we try and do at Accessia Health, and that includes providing support for other out-of-pocket expenses, not just prescription copay. And so when you think about the scenario of a patient who needs to go see a specialist as a follow-up visit, mm-hmm. That's a whole expense for these people to be able to not only maybe take time off work or to get from A to B. There's a cost for them involved, and sometimes they can't really cover that cost, as well as a potential copay, or as well as some new drugs or other pharmaceuticals they may need to follow on with that journey. And so I think what we're finding is that more and more people are coming to us and the other patient assistance organizations looking for different types of assistance. Whereas traditionally, I think maybe 10 years ago, you would have said it would have been all copay assistance. And I think that's it's a troubling trend, yeah. But it's a reality that we're having to address.
You've spent some time in the different sectors of healthcare. Obviously, that's how we met, through specialty pharmacy. So when you think of the taxing of a disease on a family and what that means, what other services aren't our specialty pharmacists or pharmacies like? What are they not thinking about that you're filling in, including things like transportation, and you mentioned a specialist, but talk to us a little bit more about how important those ancillary support services are.
Well, I think to start off with one thing. So in my own story, my wife is a brain tumor survivor, and every month she has to have anti-seizure meds, and if she doesn't get them, she would have a grand mal seizure. So I am, myself and my wife are one of those, and this is one of the things when we do talk about patients and their needs, we're living it every month. We turn up the pharmacy, and because it's a controlled substance, we can't reorder her meds until 3 days before they expire, mm-hmm. or before she runs out. And invariably, there's going to be some issue where there's a supply chain issue, or especially during COVID, we were always worried every month if she was going to have her meds there.
Yeah.
And so what I'd like to say is every single month, myself and or my wife are standing at a pharmacy counter hoping that our meds are there, okay? And there was a situation a couple of years ago where, due to COVID and supply chain issues, that the CVS, and it's not against CVS, I'm just saying, yeah. Where the pharmacy said they didn't have her meds in. They just didn't have them. And so I said, well, what's she supposed to do? And they're like, well, we don't really know. And I say that in context is that every month when I'm there, they are rushed off their feet. There's a constant line of people behind me or in front of me waiting to get to that pharmacist. Yep. And I find it a very stressful job to look at on the other side.
Yeah.
And it makes me think about, when a patient comes to that pharmacist, how is all the pressure on the pharmacist? It can't be. They can't know all the answers. They have so many things going on. And we've all been there from a job standpoint, where maybe, let's say you have an important presentation due tomorrow morning, and you've got to get your PowerPoint ready, you've got to get your notes ready. You don't have time for anything else.
Exactly.
Whether it's your, maybe your family, and maybe your friends, and maybe someone wanting to go out, or somebody calling you. I can't talk to you right now. I've got to concentrate on this. And when you think about a pharmacist, I do, honest to God, I have a lot of sympathy for those in our specialty pharmacies, because they run off their feet, and there are so many other layers to the onion than just handing someone, a bag of pills.
Yep.
So anyway, to get back to what I was trying to get to, I think it's on all of us. And I mean that honestly. It's pharma, it's specialty pharmacy, it's advocacy, it's companies who are making products in the health-related field, to get the information out there, to give patients as much information as possible so that they are aware. And I'll tell you this, I've been in non-profit fundraising primarily for health charities for the last 20 plus years. Until I started with Accessia Health, I had no idea there was a patient assistance industry. And my wife, for many, many years, we went and, we were lucky enough where we could pay our co-pays, but there was a lot of out-of-pocket expenses for her after her surgery. She had a massive brain tumor. And, it was, without health insurance, we would have gone bankrupt. We could not have paid for that surgery. But at the end of the day, she's been taking those meds ever since her brain tumor. And there was times where we were on Cobra, and had to pay full out of pocket. And these are kind of things that patient assistance organizations can help you with.
Yep.
But the other part of it is that if one of the things I found very quickly about brain tumors and about people who are going through major health issues is that the support groups are out there, but you have to find them.
Yep.
And how do you have time to find these things when you're stressing about paying for your drugs or paying for access or going to doctor's office or specialist office and so forth? So all that being said, I think this is important for us as an advocacy organization, as a patient assistance organization. I think it's important for every time I sit and speak with a pharma representative, it's not just about me saying, hey, can you fund this program? It should be about, hey, can you fund this program? And also, by the way, how can we all do a better job of assisting patients? And sometimes the pharma companies, well, not sometimes, I know all the people that we talk to on the pharma side, they're all passionate about the diseases that they represent and about the therapies where they have a specialty. And I think there's no doubt that anyone that's involved in the specialty pharmacy side of things is passionate about patients. And we just heard, Elizabeth Johnson and Melissa Page, we heard them talk about their healthcare advocate summit. When you go to those types of summits, everybody there is passionate.
Yeah.
But I always say, in non-profit, passion is not enough. You have to have a strategy.
True.
And if we just need to be more strategic about how we're communicating to patients. And we heard at the patient advocacy summit that was held in Philadelphia a couple of months ago that I think something like 30% of patients were aware of the IRA and aware of the smoothing opportunities that they could take advantage of. How can 30% of people, 70% of people not know about this? And why is it a specialty pharmacy's job to educate patients on that?
I love it. I love the stories that you're sharing. It really makes connections. Everyone listening to this podcast right now probably has a friend, a family member, a spouse, a loved one that is gone through something where it's placed more pressure and more tax on their lifestyle, on their budget, on their finances, and navigating where to go to make it all make sense. So Accessia Health, give us a shout out. Tell us the website where we can learn more about you guys.
Yeah, www.accessiahealth.org. I will say one more thing.
Yeah. Absolutely.
So I'm originally from Ireland. I'm sure you can guess from the accent.
Yeah, we like the accent.
I spent 35 years in Kentucky and I haven't picked up a Kentucky twang yet. I don't know. But I was home in Ireland in March, and my mother has been diagnosed with breast cancer, and it spread to her liver. And thankfully, she's on the meds, and she seems to be doing okay. But while I was home, I went to the hospital with her. Now, again, in Ireland we have socialized medicine, so we went to the hospital. You have to make appointments, and sometimes people talk about how you have to wait 6 months to go see a specialist, wherever it might be, and that's quite true. You have to get on a list. So one thing I noticed, Todd, was I was sitting there in the hospital with her in the cancer wing, and everybody there was either going through treatment, obviously had cancer, some types of cancer, primarily women, and went to see the specialist. And my mother's blood count was a little bit low, so he said to her, I'm just going to send you for a quick scan. Let's go down the hall and get a quick scan so I can have a look. And it struck me right there and then, because my mother just got up out of the chair and walked down the hall and got a scan. Now, here in the States, what's a patient going to say if a doctor says, I want to send you for a quick scan? The first they're going to say, well, is it covered?
Exactly.
How much is it going to cost me? And then all this stress you have. And one thing that really kind of I noticed was that even though all the people that were there to be seen were struggling with cancer and struggling with their health, they didn't have that added stress of how they're going to pay for it.
Yep.
Or what's going to happen after I have this scan or this procedure. And it struck me as that, I know we can't solve the issue over here, and I'm not saying we need to have socialized healthcare in America, because there are all other conversations we need to have about that. But it was really interesting to me that in my mother's story right now, she can focus on getting better. That's all she has to focus on.
Yep.
So she has her pills, she has her therapy, she has her appointments, and she can go to all of them. She doesn't have to worry about how much it's going to cost or how she's going to pay for X, Y, and Z in order to be able to have this. And that struck me as being, when I came back from that, it was in March, and I came back from that meeting and I said to myself, or from that trip, and I said to myself at our meetings, we have to do a better job. We have to try everything we can to make sure that every patient that comes to Accessia Health or any of these patient assistance organizations needs to focus on healing their body. Take the medications, stay on the therapies, keep that adherence at 100%, but that's all you have to worry about. And so, can't solve it today, but, but we can all do a better job of that. And it really struck me as how I think a lot of people, if they can just focus on getting better and not have to stress the financial stress, I think it's going to help them an awful lot more. And that's one of the cruxes that we try and identify, and one of the barriers to care. I think that is the biggest barrier that we find, obviously, from patients, is that it's the cost.
Absolutely. Dave Griffith, Accessia Health, thanks for being part of the show.
Thanks for having us. Appreciate it.
Harry Travis, Access to Pharmacy 2025 Accessia. Welcome to the show.
It is great to be here, Todd. Great to see you at another Accessia. Just can't beat it.
That's how we met. A shout out to Shivani Patel and the team in the technology division at Accessia. In the creation of Accessia One, you came into a boardroom in New Jersey, and you really gave us an overview presentation of where you believed specialty pharmacy was going. Probably of the 10 subjects you were talking about, you were probably right about 10 of the 10 of them in formulating where it was going. But something that you did here at Accessia was talk about the impact of artificial intelligence on specialty pharmacy, and the information that you gleaned and built in order to prepare for that presentation is something that the Pharmacy Podcast Network is going to continue to use probably over the next 3 to 6 months. So I'm excited about that resource. But congratulations on your presentation, and I want you to share with our listeners about what that presentation was about.
Well, thanks. And I am very grateful to the Accessia crowd and the Chris Benz for giving me the opportunity to give that presentation. We did it on Monday, which is fun, and we had 400 or 500 people in the room, so it was great turnout. Everybody stayed. That's always a good indicator of a successful presentation. And what I tried to do was give everybody in 40 minutes a quick overview of some of the highlights in AI in general, and how fast the technology is moving and how much money is being spent on the technology. And a lot of the money that's being spent hasn't even kind of come to fruition. So if you're not happy with what you're seeing in AI right now, just wait a few weeks, a few months, and it will change and it will get better, because there's tremendous kind of innovation momentum going. And then I just talked about pharmacy and the fact that right now, from a pharmacy perspective, there are dozens of companies out there, literally multiple dozens of companies, and small clusters of those 3 or 4 companies each working on automating or optimizing or accelerating each step in the prescription fulfillment process. And we're in the beginnings of what I call a 3-phase. My model is just a 3-phase move to a very intelligent pharmacy dispensing application or pharmacy management system. But right now we're in phase 1, where we have to validate all these single point solutions. So you've got somebody coming to you with a single point solution for copay assistance, prior authorization, DUR, and no matter how big your pharmacy is, you can only do so many things. So you're working on one of these to validate it. Somebody else might be working on another one. So the market is just slowly validating all these single point solutions to get them to very high levels of reliability, 6 Sigma plus kind of. And then when we're comfortable with those, and you start implementing them, you're going to start daisy chaining them together. And phase 2 will be kind of sequential integration. The bot that does the intake will pass it off to the bot that does the verification, or the agent. That's the new term now. The AI agent will do the benefit verification, then another agent might call out and confirm delivery or something with the patient, and then another agent will do a final adjudication, et cetera, et cetera. And then eventually all these APIs to all these agents will just dissolve down, I believe, just one man's opinion, I believe it'll all dissolve down into the application. And your pharmacy application will be incredibly smart, and it'll process a prescription, kind of no hands, ma. It'll go right through there. So, and I'm being a little long-winded here, but the punchline is, at the end of this, we're going to have very productive pharmacy teams, and we need to be ready for what happens when your pharmacy team and it's not just the pharmacist, it's the team, is 50% more productive. A pharmacy team could get X amount of work done in 8 hours.
Yep.
Now, with an intelligent application, they can get it done in 4 hours.
Yep.
And as a leader or owner, you need to be ready to, how am I going to deploy? It's not going to happen overnight, but it could happen fast.
Yep. All right. Do you remember the buzzword, I don't know, this has to be more than 10 years ago, where they started to talk about predictive analytics?
Right.
Okay. The very first thing, now that we're at now we're at the capacity of using AI to sprinkle things into a ChatGPT and all of a sudden get a whole organized realm of information on something. I remember going to a specialty pharmacy and watching the call center take specific question answer that was funneled to the EHR, that was funneled to the pharmacy management system, so they could track how is someone doing on therapy day 9 or day 30 or day 60, like what's going on. So we've collected all this data. I put all of that data, let's say I take 1,000 patients over a 10-year period that were some blood disorder.
Right.
And when they're on medication, ABC, now we put all this data into AI and say, we want to know, based on 1,000 patients, what their reaction was to the medication on day 9, on day 30, and day 60. That's just for patient care and treatment care. I'm describing something that could be done with logistics, could be done with inventory management, that could be done with pharmacy desert analytics and telling us where the next pharmacy desert's going to pop up.
Right.
Like, it's powerful. And when you say 50%, I think it's going to be more than 50%. I think you're going to be able to increase your workload by 75, 100%.
Depends on the time horizon. You could be right.
Yeah.
And it depends on your workload. Are you doing relatively simple prescriptions, not to oversimplify it? Every prescription is critical, regardless of the type of drug. But some businesses are easier than others, and they will automate faster than others. Certainly there will be segments of the pharmacy business that will move to a highly productive state faster than others.
Yes.
And one of the other points I made in the presentation is, remember, pharmacy is regulated on a state-by-state basis, not a national basis.
True.
Therefore, your ability to do something other than just dispense and counsel is dependent on how your board of pharmacy regulations are written. And some states, and I point everybody to Idaho, have really done far-reaching improvements to their Board of Pharmacy regulations and have embraced what's called full practice authority. So pharmacists can practice at the top of their license, can dispense or can prescribe, can order tests, can run a primary hypertension clinic and dispense the meds. But that's not the case in Florida. So this is it's a patchwork of evolution of all of these. But we're at an interesting point where the regulations are moving, we hope, to a more expansive view of the practice of pharmacy. At the same time, technology is coming on board that's going to give the pharmacist time to do that. If you told a bunch of pharmacists in the States right now, oh, you could do this, this, and this, and they say, when do I have the time to do that?
Yep.
And then the next battle, of course, is to make sure they get paid for it. But before you fight the battle for provider status, you got to make sure that from a regulatory status, you can do what you want to get paid for.
That makes sense. So is there any organization that you see using AI in some capacity that probably was parallel to what you were talking about at the presentation, that is just doing a bang-up job, doing it the right way at this point?
I don't think there's any one organization that's out in front of anybody else from a pharmacy operations standpoint that's using AI better than anyone else. I'll call out the Academy of Managed Care Pharmacy as an organization, an association, a professional association that has embraced AI and recognizes that the profession of pharmacy needs to have a forum, a curated forum for intelligent discussion on regulatory issues, ethical issues, operational issues, just a place, one-stop shop to go and get that information. So Susan Cantrell and her team did that with a pre-conference to their annual meeting, and now are headed that way. Accessia pretty much put together Monday afternoon was AI and the future of pharmacy, my presentation, and then Jeff Massaros and Shannon Wiley and Linnea Wilson on regulatory, and George Van Antwerp on what's even beyond that. So there's the beginning of kind of a theme developing here too. So kudos to Accessia to seeing it as well.
That's great. Hey, you have something called the RX Roundtable that you're doing, which is a insights sandbox of some amazing thoughts and topics. Tell our listeners about that.
So the RX Roundtable is an expert network of independent consultants, kind of retired executives, semi-retired executives, board advisors, but the key is it is a professional membership organization of individuals who are independent. No one is working for anybody else other than themselves, with deep experience in all aspects of kind of the pharmacy distribution and supply chain. And we offer early stage companies, Series A, Series B companies, to come and talk to us about, one, inform us of what they've got, and two, essentially test our brains against their market, their challenges, to see how we can help them in kind of an informal session that doesn't have any constraints to it. It's no confidential information, there's nothing involved, but it's just a networking event that we hold twice a month for individual companies. And then if somebody wants to work with us, great. But we have really focused our efforts right now on identifying early stage companies that are in this kind of farm tech, AI-powered space. And it's kind of a matchmaking operation. We give them an opportunity to meet people that they'd never have a chance to meet before, and kind of the 30-plus years experience in lots of individuals. It's kind of fun to watch young entrepreneurs connect with us.
I like that. Harry, it's always good to talk with you. I appreciate you always making time for us at Accessia, and we look forward to seeing you at Accessia 2026.
Likewise. Thanks for the opportunity, and have a great year between now and Accessia 26. It happens fast.
It does.
Bye-bye.
George, it's good to have you back. Access 25, Access to Pharmacy, Accessia here in Vegas. And it's been a fast 12 months because you were here in 2024, part of the post show.
I was, yeah. Always glad to be on your show, Todd, and talk about stuff. Accessia's grown a ton over the years.
It has. I keep saying to people, I think this is my 9th Accessia, and back then it was Armada Health. And this is just this is my favorite specialty business show because of how many people come here to talk business. They're not necessarily here for clinical. They want innovation. They want to meet with people. They want to know what the next thing is. Prime Therapeutics is part of that. You're here at Accessia. Talk to us about your new endeavor and what you're doing at Prime Therapeutics, and kind of a couple of things that you're excited about.
Yeah, no, I'm excited. I joined Prime about 6 months ago, leading product innovation and strategy, and now taking on some of the digital things. So it's been really fun because, as everybody knows, pharmacy's going through a ton of transformation, both on the payer PBM side with regulation and everything else, but also on the clinical side with all the innovations happening from GLP-1s to cell and gene therapy and others. So, those are probably a couple of the big areas, looking at how we help clients. We always put it in 3 buckets: save, simplify, and support. Given the complexity of healthcare, how do we help the individual member figure out the right drug, save money, navigate the complexity of benefits that we all keep putting out there, and support them? Because people that get diagnosed with everything from cardiometabolic to cancer and everything else, it's really difficult to navigate.
What you've done for years, George, is you've taken data that is super complex data, hard to understand, and you've written, you're like that prose expert writer where you're able to take data and you're actually able to tell stories. So tell our listeners a story right now about Prime Therapeutics' mission in specialty pharmacy.
Well, our mission has and always continues to be delivering healthcare that's the way we would want it for those that we love. And so as we go out and design specialty, we understand the complexity. So last year, we rolled out what we call Advocate Plus. So when somebody gets a new script, we're helping figure out, using technology, what the right pharmacy to fill that script is for them. But then we're also assigning an advocate, a live person that's helping that person with questions around the benefit, questions about how to navigate their disease, helping them to, take advantage of the insurance offering that they have. And so, as you may know, Prime works primarily for a lot of the Blue Cross Blue Shield plans, but then we also have some commercial lives and Medicare lives that we support.
I think of the role of the pharmacist, it's changing because of automation, AI, technology, taking away the dispensing part of it. I'm glad to see it go. I really am. I'm glad to see that automation and tech is taking that away, because the pharmacist can dial into what that patient is experiencing, whether it's something super simple or something a lot more complex. And that's the world that we're in right now, which is these complex diseases that have to be monitored and titrate from one medication to another, or telling them how to deal with day 9 nausea or whatever it is that they're going through. It's that pharmacist that's dialing in, including getting around the payment issues or copay issues or anything like that. Share with us some of the data, because once again, you have that interesting scope where you dial into data and start making sense of it. But talk to us about things that are happening especially from your perspective, Prime Therapeutics perspective, to make this whole ecosystem easier for the patient, physician, and pharmacist experience.
Yeah, and I'm going to tackle that two ways, because I do think, one, you continue to see the growth rate in specialty, really exceed everything else, with the exception perhaps of GLP-1s. I think there's fascinating things happening on the biosimilar path. If you look at some of the IQVIA data, they forecast $189 billion in savings from biosimilars over the next decade. But the more interesting thing I find is they set this range up. I want to say it goes from $45 billion to $350 billion. And the question is, how do we, as a PBM, we as a payer, we working with the retail pharmacies and pharmacists, get us to the high end of that range? Because the question is, how do we build a durable biosimilar market? How do we enable consumers to understand biosimilars? How do we help physicians to understand when it's appropriate to feel comfortable moving to the biosimilar? I think that's a really important topic that we're spending a lot of time on, because we want to open up opportunity. Some people view it as a negative challenge to the innovator products, but I view it as opening up dollars to be spent on innovation, and because there's only a finite pool of benefit money to be spent. And so how do we lower costs where it's appropriate and spend the money on some of the innovations that we need?
Well, I agree with you, and it's the pharmacists that you're teaching, it's the physicians that you're teaching, so they can convey that to the patient that's sitting in front of them. And when I think of the pharmacist, it's that the patient trusts that pharmacist to tell them what's going on. So if we can educate who's listening right now and they have questions, what's coming up down that ecosystem of I think of gene and cell therapy and biosimilars and all the interactions. Give us a little highlights of what Prime Therapeutics has discovered in this space.
Yeah, I think there's a couple things happening there. I mean, let's just spend a second on the pharmacist, because I do think that's going to radically change here. I'm excited about the whole cost plus. I think some people worry about it, but if we can get to a true cost plus model that pays a fair dispensing fee to the pharmacist, and we can get to a point where that allows us to actually reimburse for cognitive services, it gets rid of the issue that exists and creates a ton of the tension today between the pharmacist and the PBM, which is all these, points of disconnect, where we've created a model that subsidizes, generic subsidize the brands. And so you create all these anomalies where people can come in and say, oh my God, look how much you're paying over here. When we can get to a fair reimbursement model where there's not, high margin here and low margin there, we can then begin to say to the pharmacist, all right, how do I give you the right data at the point of sale where you can use that to talk to the patient? How do I help you understand how to guide them to the right therapy, how to help them understand their disease? And I think, in a perfect world, I was talking to somebody earlier today about years and years ago when I was at Express, we would get prescriptions, and one always stuck in my head where the doctor just wrote, fill with PPI. Like, they weren't picking the drug. They were allowing the pharmacist to pick the drug. They were doing the diagnosing. And I think in a future world, for me, where we get to physicians diagnosing, and in some cases, yes, they're still going to pick the drug in really complex, but there's so many opportunities for the pharmacist to play a much more active role in getting the right drug for the patient, helping understand their benefit design, talking to them at the counter or digitally, and guiding them and following the right care pathways. And I think specialty is where we're going to see that precision medicine really take off. And so thinking about how you use pharmacogenomics and testing in the store, how you enable home tests, how the pharmacist can interpret the test, how you use that in the adjudication process. I'm not quite sure we're there yet, but I do think in the next 5 years that hopefully we get there.
Well, what you're describing is precision medicine. People want to use that as a buzz term sometimes, but it literally is being much more sniper rifle-like, where you're drilling down into that specific patient's experience, and you're putting data and digital health and tools and AI around that whole entire environment, which makes it makes it feel simple to the patient. I just got done talking with Dr. First, and instead of having an app, they're just using text. They're communicating text and gathering data, text, and the text is all that information is getting sucked up to the EHR so they can track what's going on. Like, that makes sense. That's where patients are at. They don't want to deal with a bunch of the other things that are doing, because to them it just makes it that much more complicated. Talk to us before you go, one more thing about digital health in particular and how Prime Therapeutics has embraced that.
Yeah, so I would say, we're still earlier than I'd like to be after joining, but we're really setting a comprehensive strategy that says, let's think about the jobs to be done digitally and think about the consumer. What do you want as a consumer? I just want to understand, what does it mean to get diagnosed? How do I save money on my drugs? Mm-hmm. What does my benefit cover? I want, like you were just talking about text messaging, I want an easy way to interact, whether that's chatbot, whether it's voice. Some people love just talking to a Google Home or something like that. I think same with physician and pharmacist. They want you to put the stuff into the workflow. So put it in the EMR, put it at the counter. I don't want to go to a bunch of different apps or screens. I want to be nudged at the right time with the right data that says, hey, Todd's at the counter, and guess what? Todd has this other opportunity, and we're willing to pay you $10 to address that gap with him. So how do we get there digitally? What does that look like from real-time benefit check, from EMR integration, and then follow that all the way through to the caregiver, to the client, so they can see the value that's being created, and so all those things. So really right now, trying to take that broad digital strategy across all those things and put that story together, and then figure out the right foundational data and technology that's going to make that happen.
George, we appreciate you being part of this. Always want your insights. Can't wait to have you back on the show. Got to come back more often than just Accessia.
Yeah, I look forward to it, Todd.
All right, George.
Thanks for having me.
We hope you're enjoying this exclusive coverage of Assembia's Access to Pharmacy conference in Las Vegas. It's time for your favorite part of the show, pharmacy trivia. What drug is used to treat angina and is also used in making explosives? Think you got it? If you said nitroglycerin, you're right. Now don't go looking up how to make explosives with it, or you'll probably end up on a government watch list.
Hey, here with Chuck Collins with Healthcare Stakeholder Solutions. Chuck, it's great to run into you at Access 25, Access to Pharmacy 2025.
Yeah, great to be here.
All right, so you had a presentation that I want to jump right into. Talk to us about what you were talking about and why it's so important in the realm of specialty pharmacy.
Well, so the topic that we talked about was really around the IRA and the impact of the Part D benefit redesign and the Medicare prescription payment program. And really, we took a multi-stakeholder approach. So I actually moderated this session and had representation from Orsini Specialty Pharmacy from that end, the HealthWell Foundation, as well as IMAPTA, which is a medication access patient advocacy group. So you've got all these different stakeholders, and we're looking at the impact of the Medicare Part D benefit redesign for 2025, which just went into place, and then this new payment option. So one would say it's a payment option. Should be pretty simple, right? Unfortunately, CMS has made this rather complicated, comprehensive, and actually very obtuse, if you will. But it impacts everyone. And so we talked about the health plan impact of all this, but specialty pharmacy actually is one that once they're notified that somebody would actually be likely to benefit, that's the term they use, the official term is likely to benefit from this payment option, pharmacists have the duty to actually inform the patient right on the spot that you might be eligible for this program. They don't actually do any education on it, but they give them a brochure for them to go think about it, talk to their health plan, maybe sign up for this program. If they do sign up for this program, the pharmacy from that point on collects $0 on the next prescription. It's actually going to be taken care of by the health plan, and the health plan is going to reimburse back to the pharmacy. So all of a sudden you've got a Medicare beneficiary signed up for MPPP, and they pick up the drug, and so the perception is, oh, the drug's free. Because they're not going to get an invoice, which is a very different thing. They're going to get an invoice, a bill, if you will, a month later from their health plan. Again, another behavioral piece to this that they're not used to getting. Usually they get EOBs, COBs saying, here's your evidence of coverage. And now they're going to say, this is an invoice and you need to pay it. So there's a lot of moving parts behind this operationally. And then you have the Healthwell Foundation from a charitable foundation perspective, really looking at, okay, we have funds to help, folks, so maybe talk to us first before you sign up for this program. We might actually have a fund that's open that we can be able to help that therapeutic area, and you can bypass even doing this process.
How has the report identified how multiple stakeholders working together with these strategies to make up for Medicare Part B as in boy or D as in dog?
D as in dog.
D as in X-ray. Medicare Part D. So how have they worked together to bring this to fruition that we have the report now?
So what's interesting is that, the latest data just came out, and it's saying it's not really working well, unfortunately. So there are 67 million people in our country that have Medicare. Out of that, 50 million actually have this benefit designed for Part D. And the thing is, under the law, with this piece, health plans had to actually communicate to all 50 million people they have this new payment option. They could smooth their payments out of their maximum $2,000. So I'd say it's not working well because the report just came out and only 179,000 beneficiaries have actually signed up for this program. Wow. So that tells us there's a lack of education, there's a lack of communication, and a lack of coordination as well.
Well, that reminds me of the pharmacist who's being contacted by their people and patients 9 times more than the physician. So I think that there's a big opportunity to embrace our specialty pharmacies, our community pharmacies, even our long-term care groups, to get the information out there. I'd like to do some additional interviews with you around this research, and then like you've done, bringing stakeholders together to talk about what's their piece in this to participate in an ecosystem that we're bringing more information to our patients and letting them know what's accessible and how to get their medications paid for.
Yeah, no, that would be excellent. And I'll tell you, one of the quotes that we had from our panelists is said, a year ago, we had about 200 questions trying to figure out how all of this is going to work and operationalize and work together. And she said, today, I still have 189 questions that we've yet not answered. So it just tells you where we're all at. And, we had a standing room only session today, which was fantastic. A lot of people came up afterwards wanting the slides, wanting, to really understand and breaking all this down. So there's a lot of interest around this topic, and we need to address it because it's not going away. It is here.
Chuck Collins, thanks so much for being part of the Access 25 post show. We're excited to see you and connect with you, and thanks for your insights.
Yeah, my pleasure.
Talk to me about specialty pharmacy at any time in my life and career, my 20-year career in pharmacy. And if Sheila Arquette isn't there, I think there's something missing. Welcome to the show.
Thanks so much, Todd.
But that's true.
I guess, if you say so.
Oh, listen, my career and your career are very similar in how we've tracked and all the people that we knew in the beginning of how you started to really become an executive leader in specialty pharmacy, and all of the investment that you've made back into the industry to make sure that you're empowering pharmacists specifically in specialty pharmacy. And I can only imagine the stress of kind of like the ecosystem of what you got to do as someone that's kind of leading the NASP, the National Association of Specialty Pharmacies. But I'm proud of it because you're assuring us that there's some standards set, there's certifications involved, there's criteria, and you're staying ahead of it so that when the regulators come along, you're like, we already got that covered.
Right.
And I think that's the importance of association.
Absolutely, and I think it's more than just the pharmacist and the pharmacists and the pharmacies and the pharmacy technicians are so important, but it's all the stakeholders, right? I mean, even the role that you play in keeping all of the stakeholders connected, right? We need to understand what we're all doing, the role that we play. I always tell people it takes a village to manage a specialty pharmacy patient. It really does. It's so complicated, right? And these patients are often facing such devastating diagnoses, such a challenging time. They need to lean on all of these folks.
So the public is hit by a lot of good information, bad information, and then of course the internet lights it on fire, and TikTok, and I say there's so many other social platforms coming out. You and I have talked about this before, but just in case the listeners haven't heard us talk about this, when I hear big prominent figures who are doing wonderful things, Mark Cuban, he's doing some crazy things in pharmacy, right? However, every time that man talks about specialty pharmacy, he classifies it as a PBM trick of, oh, it's called specialty pharmacy because they want to charge more. And if that man, shout out to you, Mark Cuban, if he just attend one or two of our, an NASP, an Accessia conference, and come in and understand, holy crap, like disease state management in a rare disease where day 5, day 30, day 6 months on the same medication is putting your family in a completely different environment than you being on antibiotic.
Well, right, Todd, and it's even before all of that, right? Even getting on the drug, the care coordination that specialty pharmacy provides. I take very big issue with him saying specialty pharmacy isn't special, because yes, it is. It is. Right? Even from, the start, we get the, you get in the prescription referral, we're looking at benefits. Do these folks have coverage, right? Does the patient have coverage? What does that look like? Is there a prior authorization required? How do we work through that? Is that approved? Is it denied? How do we process that denial? And then affordability, right? Can the patient, after we go through all of this, we get it in place, we get it covered, we're ready to dispense, can they afford it? No? Okay, now where do we look for that assistance, right? And then you're right, then we start down that journey of looking at what medications are you on, what were you just diagnosed with, how does this all come together, how do we get you on this therapy, how do we keep you on the therapy, mitigate side effects, check back in with you, and it's all individualized, right? Patients all have a different level of appreciation of their disease, the drug, what they're doing, how to take it, so you have to be able to be flexible and customized. It is special.
It is. My favorite part of specialty pharmacy are the pharmacists who become the maven experts in the specific disease state.
Absolutely.
So those pharmacists are like on the phone with the patient or the patient's caregiver, probably, because the patient's sick and sleeping, and they're like, hey, you've been on this medication for 7 days. On a scale from 1 to 10, what did Mary, your mom, tell you her nausea level was? Was it a 7?
Right.
Actually, it was a 7. Like they know it because they've helped hundreds, thousands of patients on the same disease. So they're dialing in to make things more precision and more accurate and more caring and more empathetic. And you can't get that. I love, me and pharmacists. Right. I love my community pharmacists who are even our chain community pharmacists, but they're rolling through 1,000 times more prescriptions that are all over the map versus the oncology medication that dials into a lifestyle that you now have to shift your life, the way that you're living, versus the person who just got a XYZ med or an antibiotic. It's something that's just temporary.
Right, and our community pharmacists, they're doing more than just dispensing medications as well, right? We're testing, we're treating, we're immunizing, right? They're providing consultation on over-the-counter products, right? They're pulled in a million different directions, so you're right. And I think specialty pharmacy, it's just unique in that they have that that infrastructure, right? And the business model allows for them to be those experts in those, I guess, more rare type conditions or intricate, right? Or just it just involves a little bit more hand-holding for that patient, or a lot more hand-holding, really. I don't ever want any pharmacist to feel that, these folks are better. We're not saying that, right? It's just different. Right? Hospital pharmacy is different from long-term care, but we all play a role, and I think, again, one of the most trusted healthcare professionals and accessible.
Yep.
Right?
So NASP 2025 is coming. It's going to be here before we know it. It's in Denver, Colorado. I cannot wait. I'm so excited. We're going to be there supporting the National Association of Specialty Pharmacies. Talk to us and give us as much as you can without giving away the secrets. Give us some of the things that are coming from NASP 2025.
Sure. So we're really excited as well. The response this year has been overwhelming. Last year we had, we broke all records, which was great. And so this year people really, they showed up in force when registration opened. So that kind of takes a little bit of pressure off of me. But yeah, we're planning again the first day of the conference, which is on Sunday, September 14th, is our workshop day. Right. So we have 6 really focused days of learning, these workshops. But what we started last year is a little bit different, is, we asked folks, please sign up for a primary workshop, but then throughout the day, you can go in and out of the other ones, right? Let's say, you signed up for, this year we have a new one, the Art of Infusion, but you see something over in specialty pharmacy law or in Next Gen Intelligence, which is our technology, and you want to scoot over there, and then you can scoot back, right? So people can really customize that day based on what's important to them. And then the main conference starts Monday through Wednesday, and we're doing all the things that we normally do, right? Our keynote speakers, we have, a motivational, inspirational type speaker. It's also going to do a communication session for leaders, right? So we're focused a little bit more this year on trying to incorporate some business sessions, because we know we have a lot of executives who attend who aren't as interested maybe in the clinical components, because they have teams for that. They don't need CE, but geez, how do I be a better leader, right? What should I be doing? So we're focusing on that. We have our industry awards, our specialty, women in specialty pharmacy luncheon like we do. We also have an event called our Educate to Cultivate, where we're going to learn something fun about, Colorado and Denver, and it's also a luncheon type atmosphere and have a little bit of fun. We have a big party Tuesday night. The Gaylord in Denver is pretty cool because there's a lot of activities that can be done outside. It's a beautiful time of year. So we're going to get outside as much as possible and have a little fun. So, educational sessions all throughout the day, wellness activities, opportunity to network, to connect, right? And just talk about how do we make patient care better.
That's awesome. That's awesome. You gave me, before we started the interview, you kind of gave me some insights that NASP is starting to expand, and your focus and assistance to Canada, which is an important part of North America, our neighbors and trusted providers of some amazing Mediska, and I think of all these companies that are from our neighbor of the north. So talk to me about that kind of expansion.
Sure. So we've always offered our certified specialty pharmacist credential to our friends in Canada, but I have some colleagues and some friends who live in Quebec who had approached me about a certificate program for specialty pharmacists in Canada, right? Again, looking to differentiate themselves from the other pharmacy practice settings, and how can we work together? So we're developing a program for them, and we're really excited. We're also going to use that for some of our newer pharmacy graduates who can't yet sit for the CSP and earn the CSP credential because there's, a number of practice hours involved with that. So it's kind of be a bridge, like, hey, I'm working in specialty pharmacy and I know it and I have the certificate, and, I'll earn the CSP when I can, but just trying to, again, differentiate them. So we're really excited and, hope to work with Quebec's kind of its own little entity, that province. And then, we have friends, too, at the Neighborhood Association of Canada that we work with. So hoping to extend that over with them as well.
That's awesome.
Yeah.
Well, I'm excited about NASP 2025. We're definitely going to be there, continuing to support you. What do you want to tell people that are listening to Access to Pharmacy 2025 post-show? Is there anything that you kind of want to note before we wrap up?
Well, I mean, obviously we're looking for sponsors, right? We want to have sponsors, and we would just want people to be aware of, the issues and how it's more important than ever, right? With all of the pressures, I think, on specialty, on reimbursement, the IRA, what's happening with the 340B programs, some of the the legislations that's passing in different states across the country, that we have to come together, right? We want to maintain patient access. We want to maintain patient choice, right? We need to be concerned about some anti-competitive practices from a multitude of stakeholders, right? I think we talk a lot about PBM reform, but there's some other threats now too.
Yeah.
Right? I mean, what we just want to make sure, I think, that we're creating a fair and balanced marketplace where competition's encouraged, right? Not stifled. We want everybody to have the opportunity to compete, and we want to kind of challenge each other to get better.
Yeah. Exactly.
Yeah.
I like that. All right, Sheila, Arquette, we appreciate you so much. Always being a part of the show, being part of our network. I mean, you've been the conduit of specialty pharmacy to the Pharmacy Podcast Network, bringing us content month after month. It's been amazing. Thank you so much for that. And we can't wait to spend time with you in Colorado.
Awesome. Well, thank you so much for your support. I mean, you are the pharmacy champion, right, for all of us, all different pharmacy practice settings. I think it's a fabulous ecosystem. It's a fabulous profession, right? And you do a lot to raise awareness to the value that pharmacists provide, because I think sometimes they're so busy taking care of their patients, they're not doing it for themselves.
True.
Yeah.
Absolutely.
Yep.
All right, Sheila, Arquette, NASP, sign up, NASP 2025. Go to their website. NASPnet.org. Net.org. NASPnet.org. And you heard it here on the Pharmacy Podcast Network. Access 25. Access to Pharmacy here at Accessia in Las Vegas. First time exhibitors, Prosper AI. I'm excited to have you here, Xavier. Tell me about your organization and how you assist the specialty pharmacy ecosystem.
Yeah, so we create AI voice agents, so agents that speak on the phone with patients and payers, and we implement those in the specialty pharmacy system. So for patient conversations, prescription refills, inbound calls about their prescriptions, or incoming conversations, we're able to do them with AI and reduce the burden on the pharmacy technicians. And also we do benefit verifications automatically with electronic exchange, but then we do outbound calls to payers on the phone.
So this makes a lot of sense to me. So the banking industry, the automobile industry, the hospital system industry, they've all leveraged artificial intelligence voice communication with people so that you can kind of like navigate calls and things. So how is specialty pharmacy different from those other organizations? How is Prosper AI focused specifically on specialty pharmacy?
Yeah, so what we've done is we use the generative AI technology, like the ChatGPT style technology, and so our AI is very conversational. It's not like a press 1, press 2, press 3, but actually you can have off-the-cuff conversations with it. And we've tailored it to like specialty pharmacy by doing use cases that are relevant for them. So the prescription refills, we've got do thousands of these kind of calls. We know where are the edge cases that happen, and make sure that we've got great conversations with patients to get them the information they need.
All right, so I was in the way I entered pharmacy was through pharmacy technology. So I worked in the institutional pharmacy space, long-term care pharmacy, institutional and combo shops like community pharmacy. So the pharmacy management system, the Pioneers and the Prime RXs and the Suite RXs and the RX30s and all of that organization out there. Talk to me about integration with your voice systems and then those PMS systems.
Yes, so we've got 2 types of integrations. We do API integration, so directly into the systems, and so when the AI voice is speaking to the patients, it knows information about the prescription, like when it's delivered, which time of prescription it was. And another way of integrating is we do what's called RPA integration, so we get a login into the system as if we were a user, and then we're able to get the information from the system directly as clicking a robot that clicks the system. So more lightweight kind of integration.
Do you think that, describe to the listeners how the AI shifts? So if there's an NDC number that's about a blood disorder and the patient has to kind of follow a specific treatment set, is the AI starting to get proactive where it's saying at day 30, hey, listen, is it time to refill your ABC medication or whatever it is? Talk to us a little bit more about how it starts to interact with the patients.
Yeah, so there's event triggers. So in the same way as like you would with your pharmacy technician, then you would say, hey, after 30 days, reach out to patients, and like here is like a work list of patients to reach out. We configure that in the system, and we say, okay, now instead of like a human to have like that task list, it's now the AI that does it. And so we create specific AIs for specific use cases, whether it's, for example, if you have a prescription and no one has picked it up in 10 days, we create an AI that like on day 10 does an outbound call to the specific patient and reminds them of the prescription. And so there's these events that are triggered by the system to do the calls.
All right, so if someone's listening to us right now, a specialty pharmacy, they're like, we want this. Talk to us about how our listeners can get a hold of you.
Yeah, so they can go to getprosper.ai or find us on LinkedIn. And my email address also like xavier.degracia@getprosper.ai.
Getprosper.ai?
Yes, correct.
Getprosper.ai. You heard it here on the Pharmacy Podcast Network. I'd like to have you back on a This Week in Pharmacy, and let's talk more about how artificial intelligence is starting to interact with our patients, and it's going to start to become much more accepted today than it was, say, 5 years ago when everybody's like, I don't want to deal with AI. Now all of a sudden, if it's more contextual, if it's more personalized, people are going to accept it. So I want to have you back, Xavier.
100%, yeah, we love it. And what we've seen to that point is that as long as you can get the job done for the patient, patients are totally fine speaking with AI.
Yep.
Actually, they've been speaking to Alexa and to like other AIs.
True.
They proactively go to ChatGPT, right? So if you can get the job done, it's great. If it doesn't work, then like no tolerance, and like we've had 20 years of bad experiences with IVRs, right?
True.
But that's what's exciting about the moment now, like with all the generative AI technology, really like the experience is significantly better.
I like it. All right, Xavier, thank you so much for being part of the AXS 25 Access to Pharmacy Post Show.
Awesome. Thank you very much.